Well, welcome to an episode of Going Direct. We're really excited to have you here with us today. And for those tuning in, we are sitting down with Justin Hartman from the CAL FIRE ESS team.
Yep.
And you're the folks who show up when life gets heavy, situations get hard, and kind of the quiet backbone of support for our firefighters, their families, and CAL FIRE as a whole.
Yep.
So before we jump into it, why don't you introduce yourself and give us a little backstory of how you came to be with the ESS team.
Perfect. Justin Hartman, I'm a battalion chief with CAL FIRE, but more importantly, I'm the coordinator, like a statewide coordinator with ESS, which is a unit within Behavioral Health and Wellness Program, so the BHWP program.
Okay.
So the ESS, we're the operational side of the employee support services underneath Behavioral Health and Wellness. So I got into it. I was always kind of interested in the peer support role, and I've kind of had my fingers in a lot of different programs within CAL FIRE when I came up through the ranks. And then this opportunity arose for me to join this team, and it's all history from there.
Yeah.
So I've been on the team just over about a year and a half now.
Okay.
And it's just flying by, and it's great helping our own.
Yeah. No, for sure. And we met through our Family Liaison Membership 101 class.
Yep.
Because you guys come and do a presentation, did some mock situational activities, which was pretty cool. So for people joining in who might not know about ESS, can you just kind of go through a little bit about the mission of the program and kind of the role that it plays within the broader CAL FIRE?
Absolutely. So ESS, or the behavioral health, ESS was where it started in the way past, like 20 years ago. It was very limited, like one person, and then it's grown to a team of 30.
Oh, okay.
So in 2019, we merged with the wellness side out of occupational health, and they came over to the and we created the behavioral health and wellness program. So the mission of our program under ESS is to help our firefighters that are in need of any kind of assistance. If they're looking at EAP, any kind of assistance with EAP, we're kind of the subject matter experts for the employee assistance program.
Okay.
It's not an easy thing to operate.
No.
And then especially trying to find a clinician.
Yeah.
Clinicians aren't really easy to come by as well. We find and we scope out and vet the clinicians to make them, to ensure that they're culturally competent, is what we like to call it.
Okay. Maybe just talk on that a little bit then for EAP. I'm not really familiar with it in terms of they reach out. It's a clinician through you guys, not through their insurance?
Correct.
Okay.
So we're lucky. We have the tier 1 clinician set up with EAP.
Okay.
So our members get 28 sessions in a fiscal year.
Wow,
so July to June, they get 28 sessions. So they can almost go every other week in a year paid for by the state.
Wow.
Yeah, it's a huge benefit.
Yeah.
And it's not only for them, it's for their spouse and or registered partner and their children as well.
Wow.
Their dependents, just like insurance, up to 26 years old.
Wow.
So we have a very robust EAP program for our employees.
That's amazing.
And that's just the tip of the iceberg. Because we have LifeMart savings as well. We have life coaching, legal advice. There's a lot EAP offers.
Yeah. That is amazing. What kind of trends are you seeing in the types of support that CAL FIRE employees are seeking today compared to, and I would say mainly because most of our members are firefighters, so mainly the bargaining union 8 arm of it, seeing today versus like 10 years ago?
People using the program.
Oh, good. Yeah.
People calling the helpline and seeking assistance.
Yeah.
And I would just say calling and just seeking assistance is the big thing. The stigma is not going away; it's getting reduced, which is the huge portion of it.
Yeah.
First responders, we don't like to ask for help. We like to be the ones producing help, and then when we do ask for help, it's usually in a time of crisis.
Yeah.
And all of when you call the helpline number, it is. One of us is a battalion chief. It's a 24/7 helpline number that helps get those people in the time of crisis to be able to get them the resources they need, either any kind of addiction help to clinical help to kind of grief support if something tragic happened to their life.
Yeah. And if they call, what's kind of the timeline of if they were to call you in a time of crisis and they needed some clinician help, usually how long does it take before they can see a clinician?
That is on a case-by-case basis.
Okay.
So with right now, we have Magellan as our EAP program until July 1st.
Okay.
And we're changing over to Spring Health. So Magellan, I was able to get somebody in about a week to a week and a half, so 7 to 10 days.
Okay.
And with Spring Health, they have a lot bigger of a network. They are working with getting a lot more clinicians. I think there are some people that you can actually get in the day of in the afternoon, right? But it might be a virtual session, but it's still
for sure.
It's still beneficial for that employee because when you need something, you need it now.
Yeah.
Especially when you're calling the helpline. For
sure. ESS, you guys also, though, help not just if someone were to call in a time of crisis. You guys also come if there's let's say there's line of duty death.
Correct.
You guys come not only support the family, but then support the firefighters who've lost a brother or sister. And what does that kind of look like when you're showing up for that station or that incident?
So we come in as the Sacramento kind of the resource. We first tie in with the peer team for that unit and the unit itself, just to kind of have a good meeting to be able to see kind of expectations of what they're looking at getting met. We don't want to come in and say, hey, we're Sacramento and we're going to do it this way. Yeah. We usually have a lot more, a bigger pool to be able to get people from, especially the different units. And we go in and we look at what they're looking for. And we work hand in hand with the unit and the union itself to be able to make sure that we're cohesive and taking care of what matters at the time. Yeah. And it's that the family and the personnel that are affected from that line of duty death. It affects everybody in a different way. And then not only that, we have a bullseye. We start at like the most affected, and then we hear about like, hey, another person in a different unit worked with this person as well. Yeah. Since we're a giant department and we move all over the state. We might be an engineer in Riverside, and then we're a captain in Tamaglen. So our people are very transient in nature of just the job itself. Yeah. It's going from unit to unit.
Yeah. And what is like long-term support? You show up, but then is there follow-up or is that mainly up to the person to then follow up, or up to the individual to keep following up?
Well, we usually build reputation and a relationship as well with those folks. And usually when we are meeting with those folks and doing maybe station visits to one-on-ones, we get a kind of a feeling of, hey, this person, like, follow-up is going to be a good thing for this person. Yeah. Everybody's different. Some people want follow-up, and there's some people that are like, I'm good. Yeah. Like, if I need help, I'll find it, or if I want to call you. We don't want to overstep our boundaries as well and be too pushy and too needy and kind of scaring people away from our program.
No, for sure. Can you talk a little bit more about the peer support aspect of it, and how is that run by staff, or can they volunteer to be a peer support liaison? I'm not actually sure.
Absolutely. Yeah. Every unit has a peer support team. Okay. With a lead. That's the kind of the starting point if you're trying to get in, especially this program or whatnot. So reach out to your peer support lead, and there's a few classes that are required to be a member on that team. So and those classes are offered through our program, and they're usually offered in the fall and the spring of each year. Okay. So we reach out to those. There's two classes and then an application that are required to be on the team. It's a volunteer basis, but if we do get punched out, obviously we're on an assignment, so it falls under that portion of it. Yeah. So it's just a 3-day GRIN class. So it's grief for individual and group, and then a suicide prevention, intervention, and post-prevention class with a signed application to the unit chief. And then working with the unit team to kind of spread the word and assist with any kind of diffusings and debriefings that could get handled within the unit.
Yeah, very cool. What are some skills or tools that you've seen through your year into the job or this particular role and working within this department that you think every CAL FIRE employee should have to support their own resilience and mental health well-being? Like, what are some basic tools if someone were to listen to this and maybe they're afraid to call, but maybe they want a few tips or tricks of just working on their own mental well-being?
So the Cortigo app, it's passed on to all our employees, all their family as well. It used to be a secret squirrel kind of, you had to have a QR code to have the password. Now if you just type in Cortigo on Android or Apple App Store, it'll be a C. I believe it's a green background and a white C, and it's called Cortigo.
We'll add the little the icon here, QR code here. So if you're watching it, then they can scan it and stuff.
So with that it's CalFire at Cortigo.com. And it's CalFire 1881 is the password, all lowercase, all together, not a space. That offers all the helplines and the hotlines. So it starts off with the helpline of CalFire. And then it has the suicide hotline and a lot of other hotlines. And when you click on those buttons, you can call or call anonymously. So when it goes call anonymously, for anybody old school, star 67, it puts it on your phone and then puts the phone number. And then there's a lot of self-assessments in there. If you're struggling with depression, anxiety, addiction, you can take self-assessments. And what's really nice about that is it's a generic login. So it doesn't show that I'm logged in taking a stress assessment. It shows that there's a member logged in taking the self. It doesn't show who is. So that's where the anonymous kind of portion of it stays.
Can someone, I know if you're calling and you can call anonymously, can someone call on behalf of someone else?
Absolutely. But with that we're a confidential employee, so there's a government code, and not only government code that we have to follow, the integrity of our program, because if we're spreading information, no one's going to want to call because they're like, that's the information spreading program.
Right.
So we want to keep that confidential as well. So if they're calling among someone, usually they're within the room and saying, hey, I'm going to pass the phone to them. And then we stay in contact with that person. We don't stay with the person who's calling in on behalf of them. But there's sometimes that I've gotten a supervisor that called and said, hey, can you check on my employee? And that's the only contact I get with that supervisor. I call them, I check with them, with that employee, and then I stay in contact with that employee. I don't
call the supervisor.
I don't call the supervisor. It's between them and I.
For sure. Okay. Yeah. And then, so the Cortigo app, just to go back to that, it's free for everyone, even like spouses and kids, so they can access that as well, which is awesome. If you could deliver one message directly to every CAL FIRE member listening, what would it be?
The big thing is know our program, I would say, is the big thing. It's not a problem until it's a problem, and then it's a crisis. Just like we do preventative maintenance on our fire engines, that's taught within the first week of the Company Officer Academy. We need to do preventative maintenance on ourselves as well. We need to find a clinician. We don't need to go to them every day if nothing's kind of happening. Well, we need to build that reputation and that kind of relationship with that clinician. So that when stuff does happen down the road, there's hard times and life happens, you have that reputation, you know where to go, and you can continue working that way.
I mean, it's kind of, and I know we've seen just in the broader public shift across probably the country, nationally, whatever, too, the idea that mental health is also like, you go to your doctor every year for a physical.
Absolutely.
So you should be the idea of, you know, like a tune up to your car, a tune up to your physical health, you would do the same for your mental health. And I think sometimes too, I used to work for a mental health nonprofit years ago. And one of the big things was like people were afraid of if they reach out for help and they're saying, well, then I must have a problem, quote unquote problem.
Right.
But that's not necessarily the case. It's really just you're reaching out to check on your health and maintain a healthy life and lifestyle to do that. So
yeah, just like going to the doctor. Exactly, you said that. It's doing checkups, getting that reputation, and sometimes that clinician's not for you. Just like the primary care physicians, you tried one time and you didn't like something about them. Maybe they're not as attentive. They're not doing as much tests, but they're doing what they've been trained, and everybody's vibe is different.
For sure.
So that is where you can call us, and we can get you to the right clinician that we could recommend.
Yeah.
To hopefully help you with that.
Yeah, for sure. So can you tell us a little bit more about how ESS supports families, specifically not just CAL FIRE employees?
Yeah, so in our program, it's broke up to 4. The program has 4 sides. It's ESS, special projects, family support, and then the wellness. So our family support, we have one manager that oversees the family support analysts, and then we have 4 analysts right now in our program that are broken up to cover geographically in the state. So we have one in the south, kind of one on the coast, one in the north, and one in the central. So with that is if they call if the families call the helpline, or if they're using the Cortigo app, they can find their family support member if they're not wanting to talk to us on the helpline. They can find their analyst in the south or in the central portion of the state to help them get the same services that their partner, their husband, their wife is getting, because a lot of them don't know what's offered to them.
Yeah.
Because a lot of when the spouse gets home, I don't know.
Yeah.
I don't know anything about it, but the family support, they know our program and they know the benefits inside and out, and they know the clinicians, and they see and talk to them as well.
Yeah.
And they work hand in hand with us.
Yeah.
So that we can make sure that we support the families, the spouses, the children, the same way we're supporting their loved ones.
For sure. And do you want to tell us the helpline number for those listening?
Yeah, it's 916-445-4337. And that goes to one of us as a battalion chief in the program, directly to our phone. We just port that number over to our phone when we do have that for coverage. And that is 24/7. Like if you call tomorrow, you'll get me. And it's 24/7 because crisis doesn't have a timeline. It could happen at midnight. It could happen at 1 a.m. And we're responding the same way our firefighters respond to calls. We're responding to them when they're in need of crisis. And it's not a burden for us at all, because that is our job, and that's what we want to do, is we want to ensure the best health and wellness for our folks, and not just physical health, mental health as well.
For sure. I mean, it is amazing, even hearing you talk about this. I didn't even realize all that encompasses the resources that are offered, and it is pretty amazing that the department has this for their employees.
Yes, it is very great for our members and their families. Because it's years ago I heard about it, but it was nothing like this spread out.
Yeah.
We do a lot of outreach too. So every COA, Company Officer Academy, we do a presentation there. We're doing leadership presentations, leadership level 1 and 2, and then supervision level 2 as well. And then if any of the members that are listening, if they're wanting to get something to their station visits, like EAP presentations, if you can call the helpline, if you know your peer support leads, you can call them, you can call the helpline, and we can arrange to meet at your station and deliver it to not only you, your firefighters, and the other crews on the other side of the day. Because it's the only way really it can be used is to know about it. If you don't know about it, you can't call.
If you know about it, and it's encouraged too.
Correct.
It's like, this is like, it's here. It's a great resource. It is anonymous. You don't have to feel like you're worried about that. So it's encouraged too.
Absolutely, it's encouraged, and we all have our stories too. And I would say everybody probably in our program has utilized the therapy portion of it. I can say I have. I don't know confirmed, but I know we do talk to clinicians on a regular basis when we do vet them. But I have used the program to make sure that not only one, I am taking care of myself, but when I'm passing it on to somebody, that I can say, yes, this is how it is. Because if you don't try it yourself, then how are you going to be able to do it? For sure.
And it's kind of like that cliche kind of rings true. You can't help someone else if you're not taking care of yourself.
Correct.
And especially for first responders, I know that the stigma of it. But if you're not taking care of yourself, that will affect your job, your life, and it does trickle down. So it is important to take care of yourself.
Absolutely. It's very important. You can't pour, like you just said, you can't pour from an empty glass.
Yeah.
So if we're not taking care of ourselves. I know there were statistics, you always hear about numbers. The average person sees about 4 to 5 traumas in their life, where our folks can see an average of 4 to 5 traumas in a 3-day shift. So we get exposed to it. And if we're not taking out those rocks, every trauma is a rock in your backpack. And if we're not getting rid of those, one day that backpack's not going to allow us to move.
Yeah.
And that is what going to and talking to these clinicians helps remove those rocks and works through the trauma that we actually are faced with every day.
Yeah. That's amazing. Well, thank you for joining us. We'll definitely list some of all the resources you've listed, and for anyone listening, we have it on our website as well, your website. So there's definitely ways to find information.
Perfect. I appreciate your time, and it was great talking about our program.
Yeah. Thank you.
Thank you.